Hello, everybody. I'm Nikeda Brown here, the nurse practitioner who teaches and trains you on ways to get and stay healthy. I'm coming to talk to you from a familiar topic, high blood pressure today. But before I do that, make sure you like this video, you subscribe if you're watching it on YouTube, and you turn on your notifications so you can get all the information from me. I do this thing called Tip Tuesdays, so the majority of the videos you'll see posted on Tuesday to teach you how to improve your health. Okay, so May is National High Blood Pressure Education Month. So I have some notes over here. I'm going to be reading them to make sure I give you all the education that I have today. All right, so May is National High Blood Pressure Education Month. So as I go through this, I'm going to be asking you some questions. If you want to think about those in your head, you can jot them down. It's kind of for just awareness purposes only. But it kind of lets you really see how prevalent high blood pressure, hypertension is, okay? So think about this. Have you ever been diagnosed with high blood pressure? Somebody asked me the other day, does that include a previous diagnosis, meaning during pregnancy or when you were 30 pounds overweight? It does. So have you currently or previously ever been diagnosed with high blood pressure or hypertension? Think about this. Do you have an immediate family member, meaning a mother, a father, a sibling, a child with high blood pressure? An immediate family member. And lastly, do you know anybody with high blood pressure? A friend, a coworker, another family member, anybody with high blood pressure? Blood pressure does have a hereditary component, and actually high blood pressure in African Americans is due to factors unique to the experiences of African Americans in the United States. There's a dramatic difference between the number of black people with high blood pressure and the number of white people. So statistics I pulled showed that 41% of black people have high blood pressure as compared to 27% of whites. Again, research shows that it has to do with some unique factors and experiences that African Americans or black people have transitioned through over many years, but their genetic makeup still links that high blood pressure to it. Okay, so blood pressure is in fact hereditary, so that's why you can have a mom, you can have a dad, several of their children, and your brothers and sisters can have high blood pressure. The other thing we want to find out is if you are measuring your blood pressure at home. So if you're somebody who identifies that you do have high blood pressure, are you that somebody who is able to get a blood pressure a blood pressure machine and monitor your blood pressure at home? If you know people with high blood pressure, do they monitor their blood pressure, or do they just wait for an office visit? It is very important that you monitor your blood pressure and you monitor it often. There is a proper way to check blood pressure. If you scroll through my YouTube videos, you are going to see some accurate ways to check blood pressure. A couple of things I highlight is that you want to make sure your feet are flat on the floor. You're sitting for at least 5 minutes. Your mouth should be closed, so no talking. If you're in somebody's office and they're talking to you, don't answer them when they're taking your blood pressure. If you're at home and people are talking to you when you're taking your blood pressure, don't talk. You should make sure your heart is at arm's level, and you should make sure it's on your bare arm. So not over a shirt, not over your house dress, not over a sweater. It should be on your bare arm. The other important thing I let people know is that you should not have any stimulation for the 5 minutes that you're resting. So no surfacing or surfing on Facebook, no looking on YouTube, no Snapchat, no emails, nothing that can get your stress level, anxiety level, can just change the way that you are feeling at the time. You want to maintain as normal as you can. So high blood pressure is sometimes called the silent killer, right? It's sometimes called the silent killer. Why? Because most people don't know what a normal blood pressure actually is. Most people don't know what a normal blood pressure actually is. So the guidelines for blood pressure changed a few years ago. I have them right here. Blood pressure actually has a normal value when it's less than 120 and less than 80. So top number should be less than 120, bottom number should be less than 80. So how many of you watching have a normal blood pressure? Your blood pressure is elevated when it's between 120 and 129 for top number, and still at that less than 80 for the bottom number. High blood pressure or stage 1 is going to start at 130 through 139 and 80 to 89 for the bottom number. That's stage 1. Stage 2 is higher than 140. So if you can recall, you used to get some grace up to 140. Now at 140 or higher, you're actually at stage 2 for top number and 90 for the bottom number. So if you haven't already, you should go ahead and look at these blood pressure stages, identify the categories, and familiarize yourself with where you fall in terms of your blood pressure. Because there are lots of people who have blood pressure problems and they don't even know it. So let's go through a couple of true or false. Again, just answer these in your head along with me as I speak. Young people can't have high blood pressure. Is that true or is that false? Young people can't have high blood pressure. If you said false, that is correct. High blood pressure isn't just an old people's disease. High blood pressure can happen essentially to everybody. About 1 in 4 men and nearly 1 in 5 women between the ages of 35 to 44 actually have high blood pressure. Okay? High blood pressure is the leading cause of stroke, and stroke is increasing among young people. And so we want to make sure that we get blood pressure down because there's a direct correlation between high blood pressure, obesity, diabetes, stroke, and heart attack. So our next, high blood pressure usually doesn't have any symptoms. Is that true or false? High blood pressure usually doesn't have any symptoms. True or false? That's true. High blood pressure is sometimes called the silent killer. In fact, most people with high blood pressure don't have any symptoms. Many people feel fine, so they don't feel the need to get their blood pressure checked. Often I see them because they come in for something else or they're in for a sick visit, and they always say, the last time I got my blood pressure checked, it was okay. Well, when was the last time you got it checked, and what was okay? Because we just learned the guidelines changed, so what was okay one year might not be okay this year. All right, next question. Many people who have high blood pressure know it. Many people who have high blood pressure, they know it. That's going to be false. So many people who have high blood pressure, they don't know it. Actually, about 11 million United States adults have high blood pressure and they aren't even aware of it. Many people, because of the change in the guidelines, have high blood pressure and they've not gotten their high blood pressure checked. They don't know what the new guidelines are, so they are walking around with stage 1 or elevated blood pressure and don't even know it. Is that you? Are you walking around with high blood pressure and you don't know it? When was the last time you got your blood pressure checked? So what can you do to improve your blood pressure? So this is what I see all day, every day. Coming to the office, you get a high blood pressure reading, and you say, when I ask you about your blood pressure, oh, my blood pressure's never been that high. I must have white coat syndrome. Something must be wrong with your blood pressure cuff. Can you recheck that for me? So I talk about blood pressure, various reasons why you should control it, and your response is, I'll work on it. I'll go home, I'll work on it. I'll listen to all this information you just gave me and I'll work on it. So you go home and you work, but you don't work on your blood pressure. You eat what you want, you drink what you want, you gain a few more pounds. You don't think anything about your blood pressure until the next time you come in. You might follow up at the given time that I appoint you a time to return. But you show up and your blood pressure is what? It's high. It's still high. Maybe even higher. And so I get out my computer and I'm typing up your what? Your prescription. Because guess what? You now have 2 visits that your blood pressure has been elevated. And you've shown me that you are not going to put in any work to help decrease your blood pressure. I give you your blood pressure medicine. You don't take it. Let's face it. You don't take it. Because in your mind, you don't have high blood pressure. In your mind, you are able to control your blood pressure. And in your mind, you really are going to take the proper precautions and do what it takes to actually lower your blood pressure. But in reality, you don't. And so while you aren't taking your blood pressure medicine, you aren't exercising, you aren't eating right, your blood pressure is affecting your kidneys It's affecting your heart. It's affecting your circulation. It's affecting how well you sleep. It's affecting your memory. It's affecting so many things in your body that you don't even know about. All because you don't want to get your blood pressure under control. So I'm going to give you a scenario and see if you can liken it to blood pressure medicine. And so I do, for the record, like to give my patients an opportunity to improve their blood pressure their blood pressure levels. There are some ways they can change their blood pressure. Lifestyle modifications is one of them. And I am a big component of people actually using the things that they can to lower their blood pressure the way they can. There are some things that cannot be changed. You can't change your ethnicity. You can't change your age. You can't change those things. You can't change your hereditary components. But you can change your weight. You can change what you eat, when you eat, how you eat it. You can change how much you're exercising. You can change how much you're drinking, how much you're smoking. Those things are modifiable risk factors. So let's think about a bike, right? So I recently got my little boy a new bike, and it was a larger bike than his previous bike. So his larger bike, his big boy bike, actually has training wheels. And so we put him out, and we went out to this open parking lot because there are no cars at the mall. And he was able to ride on this big boy bike with the training wheels. And so I'm likening that to people who come in and they have high blood pressure. And they've had 1, 2, 3 visits to help change their blood pressure with modifiable risk factors. And then my prescription computer comes out and you get a prescription for blood pressure medicine. When you take that blood pressure medicine, you are putting on training wheels. You're putting training wheels on your heart. You're putting training wheels on your body. You're helping your body not to work quite as hard. You're helping your heart to relax. You're helping your circulation. You're helping your kidneys to not have to filter so hard. You are stabilizing your body with your blood pressure medicines, much like those training wheels are stabilizing my son on his bike. And then he is going to figure out how to ride his bike without the training wheels. You see where I'm going with this? So over time, as you take your blood pressure medicine and you change your diet and you start exercising and you start making better choices and you're not smoking and you're not drinking and you've lost some weight, over time, we can see if you can get the training wheels removed. You see where I'm going? So once we are able to remove the training wheels and you're able to ride on your own, you have to make sure that you stay dedicated and committed to actually keeping your balance, because now you don't have anything there to hold you up. When you're taking medicine, if you decide, oh, I'm going to eat this cheeseburger and I'm going to just go to town on caffeine and I'm going to eat these pickles, a whole jar of pickles that's full of salt, you don't have any training wheels because you got rid of your medication, right? So when you don't have any training wheels, you're able to decrease or come off your medicine. You have to be committed and dedicated to the process, right? You follow me? You have to be committed and dedicated to the process. Now, there are some people who are never able to remove the training wheels. Why? Because by the time we find their high blood pressure, by the time we actually are able to diagnose it, by the time we're actually able to implement some changes, they are just too far gone, if you will. And so there's no way that we're going to be able to help them stabilize their heart. The damage has already been done because of the years, the progression that they've been not taking blood pressure medicines, right? So there are some people who will never be able to remove the training wheels. But we like to catch people in the early stages, in those people who are able to adjust and modify some risk factors. And people are going to get older. And let's face it, as you get older, your vessels get harder. They become more constricted. And so blood pressure naturally increases some in elderly people. But if you are a person who is able to remove the training wheels, if you're able to remove the training wheels, or at least help hold yourself up, you should be proud. You should be wanting to do anything it takes. But the questions I have for you are this. Are you willing to deny yourself? Are you willing to say no to some of those things that you used to do for the good of keeping your training wheels off? Are you willing to get up early, to get your exercise in, to start stepping early in the day to help improve your life? Are you willing to stop eating that fried chicken, that honey baked ham, that pork, and now transition to baked food, to grilled food? Are you willing to toss out that macaroni and cheese and those things that help to add weight, those carbohydrates, all the salty foods? Are you willing to count your calories in an effort to lose weight? Are you willing to be committed to your exercise routine even after a long day at work? Are you willing to invest in some programs with proven effectiveness, with testimonies from people who have benefited from the regimen? Are you willing to give to yourself? Are you really able and willing to let the training wheels stay off? Or are you just going to continue to be in denial and keep your training wheels on, saying my blood pressure isn't high, won't invest in programs, you won't start a regimen? You think people like me who actually have programs for people to be involved in are not really beneficial because you can do all that on your own, when in fact, if you could have done it, you would have done it. So what are you willing to do to remove the training wheels? That's the question I want to leave you with today. What are you willing to do to remove the training wheels? Because the investment has to be something. You can't expect to remove your training wheels if you haven't practiced, if you haven't tried to hold yourself up without any help, if you haven't tried going down that hill, if you haven't tried going back up the hill. You can't take your training wheels off if you haven't put the pedal to the metal, if you haven't fallen. Like when we went out to that parking lot, he fell a few times, but it's in the falling that he got up and he was able to learn how to balance himself. And so there will be some times when you eat something that you shouldn't, but your body's going to say, yeah, I don't like that anymore, right? And so my question to you is, what are you willing to do when the training wheels come off? How are you willing to invest? What are you willing to change to make sure your training wheels stay off? For those of you who say, I don't want to take this many medicines, or I don't want to take medicines, but you're also not willing to do anything else to help yourself, what do you expect? What do you expect from me? Because I'm trying now to help protect your heart and the other things that are damaged as it relates to high blood pressure. Stroke, heart attack, caused largely in part by people who have uncontrolled high blood pressure, and people like you who know you have it and you don't want to do anything about it. All right, so let's talk about how you can improve your blood pressure. Eating better, maintaining a healthy weight, getting some physical activity, not drinking. That's more than 1 drink per day in women, 2 drinks per day in men, and limiting your alcohol use, smoking, all those things, right? And so make your new norm be living life without training wheels. How good is that? Make your new norm be living life without training wheels. For those of you who say, oh, I don't have high blood pressure, she's not talking to me. Well, it can happen to anybody. It can happen over time. And remember, you want to treat your body well now so that it comes to bat for you later. I tell people all the time, either you invest now in programs, you invest now in things that will help you improve your health, or you invest later with medicines, with hospitalizations, with increased rates on your insurance because you have pre-existing conditions. So it's your choice. You invest now or you invest later. All right. So if you're one of those ones who are willing and wanting to take the training wheels off, make sure you follow me. Make sure you stay engaged. Make sure you visit me on all social media so you can get tips on ways to improve and maintain your next level of health. Thank you. Y'all have a good rest of your day. Bye.